Okay. And Katie, of course, thank you so much for joining us tonight.
Thank you for having me.
Of course. And hello, everyone. Thank you for joining us. My name is Mike. I've been doing the webinars, of course, the last few weeks. So, of course, I'm excited to be here with everybody. Now, I know we, of course, have like a lot of first timers, of course. So I'm going to send everyone additional information with the email that you provided. And we have a great webinar tonight. I know, Katie's going to take it away for us. One thing I do want to mention is that we're going to have a Q&A kind of towards the end. So just make sure at the bottom, drop any of your questions that you may have. And we're going to spend like the last 15 minutes or so, of course, to get to the questions. And also we're going to provide our contact. So whatever we don't get to, of course, you could always reach out to myself, Katie. We'll be able to, of course, answer whatever questions afterwards. But, without further ado, of course, I want to introduce Katie. She's one of the clinical trainers for Aerolase. She has over 12 to 15 years of experience, of course, and we're really excited to have her on. Katie, how are you?
I'm great. And
Good.
welcome everybody to our webinar tonight. It's a pleasure to be here. Tonight's topic is one of my favorites. We're going to talk about how ablative rejuvenation has changed, and we're going to also discuss exactly what ablative rejuvenation is and the different types of devices that are used to do ablative rejuvenation.
Perfect. Let me know if you need anything, Katie.
Yep. Oh, I just went the wrong way. Sorry. Okay, so there are two methods of skin rejuvenation. And when we talk about the different ways to rejuvenate the skin, we're talking about the epidermal and the dermal layers of our skin. So the epidermal is, the top layers of our skin, the skin that we see. And the dermal layer is underneath, where we have blood vessels and collagen is building there. So when we're doing treatments, most of the time we're working on either one or sometimes both. Non-ablative lasers are a laser that is working deeper, like the Aerolase Neo. It's heating up the dermal layers of the skin to produce collagen. And then collagen production happens over time and skin rejuvenates over time. So most of those treatments are not something that you do one time and you see this really different change in your skin. It's cumulative. It takes time. It takes multiple treatments over time to change how your skin is producing the collagen. Epidermal replenishment is working on the top layers of our skin. So when we talk about replenishing the epidermis, we want to remove those top layers of the epidermis and the surface of our skin. When we do that, our body quickly will replace the skin that we've removed with new, healthier skin. With a treatment like this, you do see a more initial result after healing, but it is, because we took off, it's what we're looking at. We're taking off those top layers. And chemical peels are capable of this, and ablative lasers. A chemical peel uses, obviously, a chemical to take off those layers, whereas a laser uses a laser device to take off layers. When we talk about peels, there's a lot of confusion with chemical peels. I feel like, especially now in the industry, there's such a wide range of chemical peels. None of them are the same. You can't really use that name chemical peel and refer to all peels. They're very, very different. We have light peels, medium peels, and very, very deep exfoliating peels. So when we're talking about the depth of the peel, that will determine, how aggressive the actual treatment is. Ablation is the removal. It is complete destruction of the epidermis. Okay, so when we talk about ablation, we're talking about complete destruction, vaporization of the epidermis. And that is different than non-ablative, which is a partial destruction. Okay, so the difference between ablative, non-ablative is ablation is complete destruction, non-ablative is partial destruction, and it's going deeper into the dermal layers of the skin. The ablative laser, ablative treatments have been around for a long time. When I first got into the industry, CO2 lasers were very, very popular, being used all the time. And people were getting different depths of CO2 laser. So you can get different extremes with the laser. So you can get really extreme or lightly extreme, but the downtime with a CO2 laser tends to be, it's a long recovery. You know, it can go as far as weeks until you're completely recovered. And until your skin is really back to normal, it can go as long as 1 to 2 months. Where an erbium ablative laser is a little bit less intense that way with your downtime. You definitely have a shorter downtime, and the results are very profound. And, you know, in my experience, I see a very similar result from a CO2 ablative and an erbium ablative laser. I don't see this drastic difference in the two treatments. I see, you know, clients getting very similar results and very similar long-term results also. The difference of a CO2 and an erbium. So an erbium ablative is more superficial than the CO2. It's fractionated. It goes dermal and epidermal. That being said, a lot of people may argue, well, is that if you're not really getting into the dermis with the erbium ablation, are you creating collagen still? Because we need to get heat into that dermal layer to be able to have collagen reproduction. But the residual heat from the laser and the amount of heat that gets into the skin is still causing that collagen production. So let's talk a little bit about Aerolase and the Era, which the Aerolase Era is a 2940 erbium laser ablative treatment. It is a really phenomenal treatment. It has two different spot sizes, a 10 millimeter spot size and a 6 millimeter spot size. Your 10 millimeter being your less aggressive, with your 6 being more aggressive. Ablative treatments are something that has become really popular, not only with clients who are at an advanced stage. We're seeing it often in younger clients. And the way that that looks is, just because you may not have wrinkles yet and you're not really aging yet, younger people have issues with their skin also. You know, we have a lot of young people who come because of acne scarring, and an ablative laser does such a phenomenal job at smoothing out those acne scars. So also, because of the age of a 20-something, their collagen is producing already naturally. They're still making collagen at a pretty rapid rate. So when they get a boost to their collagen production with a laser treatment, they really get a quick result and they bounce back really fast from it. So it's just, they can usually get away with doing maybe one treatment instead of a multiple amount of treatments to get to where they want to be. So the Era does a really great job at clearing the epidermal skin. It takes away fine lines and wrinkles. It also prevents us from getting more damage, because we're constantly, it's not building on top of each other. We're taking off the old damage. It's really amazing for aging skin. It can, you know, I've seen someone have results with the ablative laser that they literally look 10 years younger after the treatment. It's just really phenomenal. And the results continue to grow. So you see what you see after you're healed, but then for about 6 months after the treatment, you still are seeing your skin getting better. And you know, that collagen starting to come and your skin is getting firmer, and it happens over time. So it's not just the result you see immediately, it's something that we see happening over the next 6 months. So this is a good photo of what our damaged skin looks like and how a CO2 fractionated laser, or a fractionated laser at all, works, and how the erbium ablation works. So you can see fractionated means 50% intact, 50% not. So we're leaving damaged skin behind. And the theory is that the damaged skin, the healthy skin heals the the skin that was damaged by the laser. With the Era or a 2940 Erbium, we're talking about complete ablation. So we are removing the entire surface, not just 50%. We're moving the whole surface. Okay, so the other thing with CO2 compared to an Erbium device, CO2 lasers, they use like a scanning method. They're difficult to overlap and keep them a consistent treatment across the face. It's easy to skip areas or miss a spot. And the bad part with that is that there is a demarcation usually with a CO2 laser. So you can't really spot treat or do half the face or just do an eye treatment because you will have a demarcation from the skin that wasn't treated. So it's really, you really have to do a whole surface, and you have to be really, really careful with how you're laying your pulses down. The delivery method is it ablates the top layers, but it also goes deep into the dermis to cause some collagen production. It takes more than one treatment. It usually is about 4 treatments for this, for this procedure. And the final result takes several months after that. Okay, and this is just some photos of, what it is capable of and how the person's skin is progressing after this CO2 ablation. And then we are talking about our erbium ablation. So the difference is the downtime is so much different. It's so much less. I do a lot of these treatments. So I really don't see anybody going past a 4-day downtime when their skin is really not back to normal by the 4th day. Now, that being said, it does depend on how aggressive you are with the treatment. You can be more aggressive by doing more passes or using the smaller spot size. So that would, require some longer downtime. But with a, regular treatment with a 10mm lens, 1 or 2, even 3 passes, you're looking at 4 days of downtime with complete renewal of the skin. And even the downtime that you go through it's really not terrible. It's just some redness in the skin and then flaking of the skin. About the 4th day, you'll start to peel and flake. Okay, and these are some pictures. There offers the result of what is considered, an aggressive treatment without it being very invasive. So especially right now, we see a lot of really invasive peeling treatments, not just with lasers. There's a lot of peels out there right now that are extremely aggressive with peeling those top layers of the skin off. And for one, I really think that it's almost too aggressive. I feel like you can accomplish the same thing with doing multiple treatments spread over time. So if you do a treatment, for example, if you do an Era treatment, it's the 2940 Erbium, which is ablative, and you do it mild, not real aggressive, just minimally aggressive, you're going to be down for 4 days, and it's social downtime. It's not, terrible downtime. And then you're going to have your result. And if you want to do that treatment again in, say, 4 to 6 weeks because you want to take it a little further, you can. But your healing time will be the same. You just are looking at 3 to 4 days downtime. Where some of these peels or a very strong CO2 fractionated ablation, you're looking at being down for weeks. And I just don't really think that that's very practical for most people to be able to just be down for weeks. Well, maybe this year it was practical, but in most times it's not so practical for us to be able to, take off from daily life to heal for 2 weeks. So that's another really great feature of the erbium ablation. You can do it a Friday night and head back to work on Monday and have phenomenal results. And, you will see that your clients just love this treatment. Because they do see that instant gratification. They see a change in their skin immediately after the treatment, a tightening, and pores look so much more closed, and the whole overall texture tone of the skin is just really beautiful. So your clients are really happy. I find that clients who do this treatment are always coming back to do it again. And they maintain it over years, you know, by doing 1 to 2 treatments a year. They are just so happy with what it does long-term to their skin and what it does initially right after treatment. So it's just a really great treatment with minimal downtime. Another thing that I like to talk about with an ablation, with the Ablation treatment, is using this treatment with your injectable clients. I like to talk about this because a lot of times we have injectable clients who really strictly stick to injectables. You'll see them in your office because they're getting Botox or they're getting filler, and they're not really the same client who's coming for aesthetic treatments like chemical peels or laser treatments. They are really more injectable. But they tend to ask the question, and I hear this all the time, what can I do for my skin? Like, I like how my Botox looks, I like how my injections look, but I feel like the integrity of my skin really just doesn't, you know, look like it could. But this same client maybe doesn't want to come into the office every 4 weeks or to get a peel or to do, you know, a treatment that is cumulative. So this treatment they can do twice a year and have phenomenal results and change that texture of their skin so that they are getting their injectables, but they're doing this also so their skin is looking really phenomenal and they're also happy with their injections. So I really push this to clients like that, you know, who don't like how their skin is looking, but they're also maybe not willing to commit to coming on a monthly basis to your med spa or your office. So it's really a great procedure to push for your injectable clients. And, you know, 9 times out of 10, they're so happy and they're always coming back to have a second, third, fourth treatment. The Era Elite is just pure rejuvenation of the skin, and the results are always, you know, I've probably done this treatment to people hundreds of times, and I'm not really exaggerating, like at least 100. And I have never said, like, had a client say they weren't happy, they didn't have a good result. I've never had a client have an issue, you know, with their skin because of the treatment. It's very, very consistent and very predictable. And that's what I really, really like about the device. I know what I'm going to get, and I know how it's going to work. And it's just a real safe treatment to do. Sometimes people get really intimidated by ablation and they think that, you know, it's dangerous or it's hard to do, but this laser is so easy to use and it's really not dangerous if you know you're trained properly. It's very easy to apply, and the results that you get are they're just phenomenal, and people are always happy. So as far as the market goes with rejuvenation, I really think that at the end of the day, everybody wants something that's going to happen fast, you know, that's going to happen quick, and that they're going to see really, you know, quick results, and they're going to love whatever they do. They're going to love it like day 2. And I try to talk to my clients, you know, before I ever treat anybody, or when I'm teaching other people about dealing with their clients, expectations and what what for them to expect from a treatment. If you are honest and open about that, and you really explain to them what you are capable of doing for them and what you can improve or can improve, you know, because every client is different. You can't treat your 20 something, that end of the age spectrum, the same as you treat your 50 something or 60 something, because they're not in the same place to begin with. So I can't take a treatment and do it to the 20 something and do the same treatment to a 50 something and expect them to have the same result, because it's just not, you know, it's not realistic. So we have to, you know, really evaluate each client and know what you're capable of doing for them and how long it might take. You know, sometimes I will say, like, I need 6 months. If you give me 6 months and you do the things that I recommend, I can promise you that you're going to be much happier with your skin at that point. So, giving that expectation of what a treatment is really capable of is a really great way to maintain your clients and to keep them coming back, because you're building trust, you're building rapport with them, and you're definitely going to show them, you're going to be able to give them what you promised when you're giving them a realistic expectation. With younger age clients, they are very interested in Botox and fillers, obviously, but they also are interested in the integrity of their skin. So basically what you're working with a younger client is just maintaining that skin and trying to keep it where it is. You want it to stay youthful and not age as rapidly as it may, as it would age without these treatments. It's very preventative when you're working with these younger millennial clients. And with older clients, a lot of times we're trying to reverse. Sometimes you'll have a client who's been coming for many years and they always took care of their skin. And obviously they're a lot easier to work with than somebody who has gotten to a point in their life and they just decided that they hate how their skin looks. They don't feel comfortable how they look, and they want to do something about it. And who else to turn to but a medical spa or somewhere that's doing skin rejuvenation. And they come in and they're like, I don't like this, I don't like that, I want this to be different, I don't like how this looks. And they're 50, say 5 years old, 60 years old. You can't fix all of that in one day. It's not possible. It took them a while to get there. So to get them to a better place is going to take some time. So we need to look at treatments that are going to work for that person. So depending on what their issues are, not everybody has horrible sun damage, or not everybody has rosacea or melasma, or some people's wrinkles are worse than others, so it's always important to take a look at that person and address the concerns that concern them, not what concerns you. So I always ask, why are you here? Like today, why did you come into the office today? What is your concern? And if they tell me the concern is the redness in their skin, then that's going to be the first thing that I'm going to focus on. I'm going to focus on getting that under control for them. And then once we have a relationship and some rapport, then I can say, we have some sun damage here, or, why don't we talk a little bit about this melasma that you have? But let's address what they want to fix first and then work on those other things. Overall skin health and appearance is really what we want to achieve, but we can't achieve it in one visit. So that's how we maintain our clients and have them coming back and staying with us, is because we're showing them results every time, but they know there's always more to do. There's always more to improve. And if we set that path up for them, then they're definitely going to want to come back because they're seeing results so far. Why wouldn't they want to take it, to the next level and continue to improve their skin? So basically, we just talked a little bit about this, but the younger clients are really here to preserve their skin and to keep it in this youthful stage. And then our older clients are trying to recapture their youth and bring their skin back to that youthful stage. And I really think that the elder side of this, like 35 to 50, these women are starting in their 30s, they're starting to see signs of aging. By the time they're 45, 50, they are aging. And a lot of times, we have these fantasies of going back to our 20s, but it's just not realistic. And I try to explain that, like, you don't really want to look 20. You want to look the best you can possibly look for 45 or 50 or however old they are. You want them to look youthful, but not so much young. They want to have a youthful appearance, not look tired. Their skin, they want their skin to be clear, not have, markings, all, sunspots and melasma and a lot of really harsh wrinkles. So it's that's really what someone of that age is looking for. So it's really two totally different clients, someone who's trying to preserve and someone who's trying to rejuvenate and, give a youthful appearance that they've lost. Resurfacing typically refers to procedures to treat a specific number of conditions. So ablative treatments can really do wonders for so many different things. It works amazing for wrinkles. It works phenomenal for acne scarring. It's always a go-to for acne scarring. With acne scarring, yes, you do want to get collagen production and plump the skin, but you also want to get some layers off the top so we can smooth the surface of the skin out from the scarring. It works really great with the tone and texture of the skin. So it's just, and freckles, I was looking at freckles, and sometimes we get confused, like, is freckles, are they a sunspot? What are they? So there's freckles from the sun. There's freckles that people do get from the sun, but there's also freckles that are genetics, that they started to get in their really young years, maybe, when they were like 3, 4, 5 years old, they started to develop freckles, whether they were in the sun or not. And that's a genetic freckle. So I find that if someone has genetic freckles, they're a little bit more difficult to remove with treatments and with ablation, but you can lighten them, but they really are a little more difficult most of the time. But if they're freckles from the sun, then that's a different story, because they tend to be able to lighten better, and you can get rid of them easier. But a lot of times when people have a natural freckles, they really aren't concerned because they're used to them. They've had them their whole life. So when we talk about fractional ablation, you also want to talk about, okay, I'm sorry. I was reading the wrong slide, excuse me. You only apply topicals to your face. That what you're doing with fractional ablation. So when you put topical moisturizer on your face, let's say, you are only getting, so it's only getting so far into your skin. It's not, your creams and moisturizers are not really going down deep into your skin. They are, staying pretty much on your surface. But when we keep our skin ablated and exfoliated, then our creams and our moisturizers, our serums are able to get deeper into the skin. So these are just some different combinations that you can do with different treatments. We have injectables, we have regular home skincare, microneedling, PRP, microderm, and non-ablation lasers. So all of these treatments are good treatments. They all work, but it's what is right for the right client, and also what combinations will be best for which client. I can have 2 people who come to me in a similar age range and similar skin type, with similar damage to their skin, and I could do the same treatment to them. So let's just say I did a microneedle to them, and I could have really phenomenal results with the one client, and the other client has a result, but maybe not as amazing as the other. That has to do with that individual person. Everybody responds and reacts to different treatments differently. So it's important that you try different things with your clients and you combine different treatments for your clients so that you can find out what they do respond to well and what works well for them. So it's definitely important to not just say, always do the same thing. Combine things, try new things, do a protocol of one procedure, and then possibly, their next time do a protocol of a different procedure. You want to keep your clients there. You don't want anyone leaving for months at a time without coming in for some type of touch-up or some type of treatment. Okay, so another thing is that the treatments that are popular tend to really travel across an audience quickly. So that's really great. And that being said, you hear a treatment that you've heard of, and a lot of times people will see them on social media and they want it, but they don't really even know what it is. They just want it. So it's important to, explain to a client why or why not, or is this a good treatment even for you? Just because something's popular doesn't always mean that it's the best treatment out there. So it's really important that your patients feel satisfied when they leave your office and that they want to come back and that they were given the right treatment, not necessarily the treatment that they wanted, because sometimes what they want is not, what they need. I can't tell you how many times if I meet somebody and they know what I do and they say, oh, I had a laser treatment before, and okay, that's nice. What kind of laser treatment did you have? And 9 times out of 10, they're not sure. They really don't know. And, it's kind of scary that they don't ask these questions, or that they don't know even what device was used on them or why it was used on them. They went there because they were concerned about brown spots, and they were given a treatment that doesn't even really do anything for that. So if their knowledge is important, but it's your job, to educate them on what are you doing to them. They need to know, because it's just going to make them a better patient to you. The more they know, the more capable they are of maintaining their skin along with you. So when we talk about wowing a patient, the way we wow our patients is we show them results and we give them proper expectations, just like I was talking about. So ablation, an ablation treatment is one of those wow treatments, because after the skin exfoliates, there is a drastic change in the appearance of the skin. Okay, you can see here in this picture, this woman had some really open pores, and in the second picture, after one treatment, it's substantially better. When people have a substantial change like that, they feel really satisfied. The thing is that it doesn't mean, even though they had that amazing change, if they don't do anything again for, let's say, a year, their skin is going to eventually go back to where it started. So the trick is to keep them there, to do this wow factor treatment, but then show them and teach them how to maintain those results. And the way they maintain the results is by getting more treatments. So maybe they do an ablative erbium treatment, their skin looks phenomenal, and you have them come back in 4 weeks and do a dermaplane and a light chemical peel. And then you have them come back and you maybe do a series of YAG skin tightening with the Neo, the Aerolase Neo. You can do a series of that to help their collagen production. And then after that, maybe, you have them coming in every 8 weeks and do a radio frequency. Like, you can just mix up whatever devices that you might have in your practice and have them just on a regular basis coming to you and maintaining the results from their initial treatment. So that's really important. And then also doing another era treatment, maybe in 6 months, for depending on your client. So if your client's really young and they did one treatment and that was good for them, they might not want to do it again for a year if they're in their 20s, or maybe 2 years if they're in their 20s. For someone who's in more advanced age, I'd like to have them do multiple ablation treatments in a shorter period of time. So I might have them do one, and then 6 weeks later do another, and then 6 weeks later do another. So they would do 3 in a kind of short span of time, and that really gets their skin like return back time and then maintain. So that's for a more advanced patient. Everybody you treat will be different. It really depends on the damage that you're trying to fix, and it depends on the age range that the client is in. I really believe that in a practice, it's important to have that wow treatment device. That treatment that is going to really, like, that's what you're going to use for clients who are really looking for something to change quickly. It's a great device to start with for someone like that. It's also really great, like I said, for injectable clients who just really aren't taking care of the integrity of their skin. They're trying to fix everything with injections. So the Era Elite Ablation treatment, it is a wow treatment. It really will set you apart by having something like this in your practice, because not every practice has an ablation device. It's not you can't walk in any med spa or doctor's office and they don't all offer ablation, but it's definitely going to set you apart from those practices. So I really personally love this treatment for myself. I've probably done it maybe 5 or 6 times, and it just is so astonishing the difference you see in your skin from just one treatment. You know, like this client here says, my skin is bright, my pores are missing, and my texture is smoother than my youngest baby's bottom. The rejuvenation and texture honestly amaze me as well. I've been doing this for nearly 16 years, so not a lot surprises me. Very little downtime and no pain. When's my next treatment? So I actually know this person. I've worked with her in the past, and she is really, really a knowledgeable esthetician, and she is amazed by this treatment. I actually worked with her on training with this device, and she couldn't believe the change in her own skin from one treatment. You know, just any time you can get results in one treatment that are that substantial, it's really exciting. So that's why I love doing it, you know, and I love the results. And I really do feel like it was like a game changer for my skin. You know, when I started doing ablation, it just really definitely upped the ante and getting my skin to a better spot. So this is another, I think this woman is in the same practice. So I've officially been refreshed. The EraPeel procedure only requires a little downtime and will help with texture, pores, lines, acne, scarring, overall rejuvenation. And she talks about she hasn't worn foundation or powder since her procedure a month ago, because it really does like give you that photo finish look to your skin, which is like really great. I call it selfie ready, so you don't have to use those filters. And this is somebody who did this for pigmentation, tone, pore size. The other thing I love the Era for is eye treatment. You know, there's not a lot we can do for eyes, and I'm sure everybody finds this happens. Like people come and they say, my eyes are so wrinkled, my eyes are so dark. And because of the location of that skin being in that periorbital rim, you can't treat it with a lot of things. You know, you can't go inside that rim with most lasers. So with the Era, you are able to treat all the way to the lash. You can put shields in the eyes and treat that way, but this is my go-to for an eye treatment. It's just really amazing the change that you see in people's eyes with this treatment. It tightens the skin, it removes pigment from the skin. It just is just overall so amazing. And the other great thing about it is you don't have a demarcation from this ablation. So you can do just an eye treatment on somebody and you don't have to do their entire face if they don't want to. Or they can do their face and then come back for their eye treatment if they feel like it's a little bit too much to do both at the same time. So you have that option without worrying about demarcation. And these are just some really good pictures of different treatments. And you can see here with this scar, how phenomenal of a change that this facial plastic surgeon, Dr. Watfa did. And it's amazing. Like, that's just life-changing. And you can use this for other areas. I use it a lot for the décolleté. You can use it neck, people's hands. We've used a scar anywhere on the body you could use it for. So yes, I would say facial treatments are, you know, the most popular, but it is possible to use the treatment on any part of your body. And the other thing about this device and this treatment is it, you know, you can charge a real substantial amount for one treatment. So for a superficial peel, you're looking at anywhere from $1,250. I mean, I worked in a med spa that charged $1,500 for a superficial peel, and they got it all day long. Like, people were coming back all the time for it. So it the revenue from the device really is a lot. Oops. So, that is our presentation on the Erbium and ablative lasers. And I'm thankful that everyone was here today. And if anybody has any questions or, wants to talk about anything, you can put them in, type them in. Thank you for having me. Oh, I can't hear you. I think your mic is off. Is it?
Is that better?
Now we can hear you.
Did you hear me? Okay, perfect. Yeah. Okay, perfect. So yeah, I was just saying that if there's an email that you had, that obviously that we could, email some questions to, because I know a lot of times at the end, some people have questions afterwards. So
That's fine. Sure. I can just say, should I just say it?
yeah, that's fine.
Okay.
Of course.
So it's Katie. So I'm Katie with a C, Catie, Cutler, Cutler. So CatieCutler@gmail.com.
Perfect. Yeah. And I also put my email in the bottom too. So if anyone else has any questions, of course, I'm here to, of course, answer them. But yeah, Katie, I know we're going to have another one in the future with you. So it was great having you on, of course. Looking forward to the next one.
Thank you.
Yeah, thanks again. And of course, I believe also we're going to send out a calendar invite to everybody. So just be on the lookout. It's for next week's seminar. So of course, you could just go onto our website and join us. But Katie, thanks again for joining us, and we'll see everyone next week.
Yep, sounds great. Thank you.
Bye. Thanks again.
Bye.